Good morning to everyone who's joined this webinar today. It's a pleasure to be here. I'm Dr. Paul Glassman, as you see on the screen. And among the number of things that I'm doing in my life these days, one is helping to start a new dental school at California North State University, which you see on the slide as well. And so today we're going to try to be spending some time talking with you about the new world of oral healthcare, really oral healthcare in the COVID and then post-COVID world. Clearly things have changed dramatically in oral healthcare, but there were already some significant changes in place even prior to the world of COVID. And we're going to talk a little bit about focusing on teledentistry as the sort of a major driver of change in the COVID and post-COVID world. And I want to acknowledge the support for this webinar from the Virtual Dental Care Company. You're going to be hearing in a little while from Dr. Bill Jackson, COO of Virtual Dental Care, talk a little bit about a product that they have called Teledentix, and we're going to reference the ability for that product in conjunction with the concepts that I'm going to present to make a big difference in making dental offices more efficient and safer in the COVID and post-COVID world. So, with that, I'm just going to put up a next slide, which is my disclosures. And so I do have consulting arrangements with a number of different companies, including DentaQuest Partnership and Virtual Dental Care, and a number of health departments where we're teaching people how to use telehealth, and then multiple dental care providers, mostly through grant-funded projects. So let's just move into a little bit of just a few minutes on what's happening with the broad dental care industry in our country. So this is just one bit of data. It'll be very little of this kind of stuff, but one little bit of data about who's getting dental care in the United States. So this is really pre-COVID. For a long time, it's been known that most people in the United States are not getting dental care or getting dental care on any kind of regular basis. It's shifted a little bit since this data. So now children, which is the orange line, are a little bit above 50%, but still almost half the children in the country don't even get an annual dental visit, and only about 40% or so of seniors, and only about a third of working age adults. So most of the people in the United States are actually not getting dental care on any kind of regular basis. In fact, we have a dental care system that is primarily serving the wealthiest and healthiest segments of the population. Those people who are most likely to go into a dental office tend to be the people who are the most affluent, the people with the highest level of education, and also the people who have the least amount of dental disease. And so the people with most of the disease in the country are actually not getting into the dental care system. So it's a problem, of course, for people who are not getting dental care. It's a problem for the dental care system because there's so many people out there who need dental care and even have some means to pay for it, who because of other kinds of barriers are not getting dental care. So the other side of that coin, of course, when you have a big problem like that, is it's a huge opportunity. And so we'll talk a little bit about how that opportunity might manifest itself. You know, one of the things that people are thinking are driving change is sort of embodied in this diagram here, where you look at the sort of a way forward for the dental industry to be able to get back into contact with the majority of the population. And so one of the things that's driving change is looking at different kinds of measurement and payment systems. We won't spend really any time on that today, other than there are all kinds of groups at work, including the American Dental Association, looking at ways to measure outcomes of healthcare and to be able to reward providers for actually producing healthier people and even healthier populations. So that's going to have an increasing impact on the way we think about dental care, but we're not going to spend any time on that, just to know that there's more attention being paid to actually having people healthier as opposed to just doing lots of stuff on them. The other part of the circle is prevention and behavior science. And we have, certainly from the time I was in dental school, some really great different understanding and new ideas about how to prevent dental disease. So if you're in contact with some people, I titled this slide, "The Declining Role for the Dental Drill." And there's lots of things that can be done now. You know, that upper left diagram where you see those little brown spots on the tooth. You know, and when I was in dental school, there's nothing you could do except reach for the dental drill and drill those things out and put a conventional filling in there. And now we have remineralization agents, we have caries arresting medication, we have understanding about you can actually seal caries in teeth and it's better for teeth. So, you know, fluoride varnish and silver diamine fluoride. And we have techniques related to sealing caries in place, including traditional dental sealants, but also the idea of interim therapeutic restorations. I'll give you an example of that in a few minutes. But the point being that when you're in contact with people, we have lots of things that can be done to keep people healthy that don't require dental drills anymore. They actually don't require dental drills, or not even necessarily a dental office. Things that can be done in a community setting that can make people healthier that just didn't exist, decades ago. But we're really going to focus our time today on this third part of the diagram, which is on delivery systems, and primarily on using teledentistry to reach people who are not traditionally getting dental care, or at least face barriers to getting dental care on a regular basis. And so when I look at the around the industry, what I see is teledentistry beginning to roll out in these ways. That we have groups that are doing things that I would call advice and referral. So that's even at the level of an individual dentist. So a patient takes a photograph of their tooth and they send it to their dentist, and then the dentist can provide some advice, and typically that ends up in come into the office to see me. Now, advice and referral is also being done in a way that some companies do what we refer to as a call center. And in a call center, there might be some advertisement about their services. People sign up, they may pay a fee, they talk to a dentist over a video conference, and typically that ends up with a referral to a bricks and mortar dental office. So that's sort of the call center approach. And for those things, they might be using video conference software or some kind of cloud-based platform to be in touch with people through at least a live video conference. And then we have other groups that are beginning to do things like labeled here limited on-site care. And that's where you might have a team that would go into a business or a school or a Head Start center or a nursing home and bring some portable equipment, maybe collect some records, do some preventive procedures, have a dentist review those records. But typically that limited on-site care, they end up in a referral to a bricks and mortar dental office. And then finally, the last category of companies that are beginning to form and people beginning to do things what I refer to as full service care. These are similar to the limited on-site, and you might have a team that goes into a community site, again, a business, a school, a Head Start center, and collects records and has a dentist review them. But in this case, the dentist is actually part of an integrated team, and the dentist is able to make the diagnosis and treatment plan, and then the person's able to go to that dentist actually to get care, which has a lot of advantages because the dentist has already reviewed the records, they know what needs to be done, they're able to provide that care in a much more efficient manner, and it's sort of one seamless full service system of care with different people being in different places. So we tested out that concept for a big 6-year demonstration project. We came up with the name Virtual Dental Home, meaning that we're satisfying all the requirements of what people traditionally think about as a dental home, but we're doing it with this idea of this geographically distributed Telehealth-Connected team system. So this is an example here of a dental hygienist and her assistant, and they've got using portable equipment. All that stuff fits in the car. They can be in one place one day and another place another day. It takes 15, 20 minutes to set up, and then they're sort of set for the day. And so when they're in a community site, what they're doing is collecting a full set of electronic records. You can see the laptop computer in the back, which includes here using a Nomad X-ray source to take radiographs and photographs, and collecting really a full set of digital records, everything you expect to see in a fully cloud-based or fully electronic record system if you had electronic records in your office. And I won't walk through all the details of this flow chart here, but they're collecting the records in the community. They're going into this cloud-based record system. The dentist who's not on site is actually reviewing all the records and making a decision. And the primary decision is this somebody who needs to come into a dental office because they need some things done that only a dentist can do, and you really need all the equipment and surgical services available in a dental office? Or can the hygienist do things that keep them healthy in the community, or both? And most of the time it's both if they need to see a dental office. So an example of something that can be done to keep people healthy in the community, and not true in every state, but in California, we have the ability for dental hygienists to place interim therapeutic restorations. And that's sometimes, if you're not familiar with that term, has been called a traumatic restorative technique, or more colloquially, it's a sort of scoop and fill, which is a tooth like this for that young lady who's in a low income school. Typically what happens is nothing until there's that small hole turns into a bigger hole and a bigger hole. And then the child is in school with a toothache and they're not paying attention, or gets worse, they end up in the emergency room or maybe even a hospital. And so now, with the dentist making the diagnosis and providing instructions, the hygienist in just a few minutes can remove that the soft material and seal that tooth with a glass ionomer. That's an interim therapeutic restoration technique. And that tooth can now be in that holding pattern for many, many years. There's really good data about the effectiveness of this kind of technique. So it really sort of revolutionizes our thinking about who needs to actually sit in the dental chair in a dental office, and who can actually be kept healthy in a community site. So we tested out this concept across California in 13 different communities at about 50 different sites. And we were clearly able to show that we could make this idea of telehealth-connected teams work. We could have different people in different places that are being able to interact together and form a full service system of care. I just want to pause for a second. I actually should have done this earlier, but there's a question box. And if you if you have questions either during the presentation, I'll be looking at them, or afterwards. We'll have some time specifically for Q&A at the end. But if you have questions in the middle, please feel free to post them. And by the way, one just came up which says, "Why are we still calling glass ionomer restorations interim?" Well, it's interesting. The history of that name, interim therapeutic restorations, is the name that was coined by the American Academy of Pediatric Dentistry to describe what was in the worldwide literature as the atraumatic restorative technique. And I completely agree with what I think the sentiment is in that question, that that the name interim is really misleading, that it gives the connotation that they might have to be redone, or they're more like a temporary restoration, which they're not. We now know that these restorations can last as long or longer than what people think about as more conventional restorations. And I agree that it's not the best term. We have used it because it's sort of the, in the United States, it's the defined nomenclature for this kind of restoration, and it appears that way on in payer organizations that are paying for care. So, but I think I appreciate the question, because it does point out the fact that that term is actually misleading, even though it's the commonly used term that's in. So thanks for the question. Okay, so telehealth-connected teams. And in that demonstration project, we were able to show a couple things: that we could reach people who were not getting care previously, and we can emphasize prevention and then lower the costs of all the neglect of care. In fact, with children, we found that 2/3 of the children, everything that had to be done could be done by the hygienist on site, with the combination of traditional dental hygiene procedures plus the interim therapeutic restorations. In fact, this demonstration project was done before silver diamine fluoride was available in the United States. So we're now estimating as many as 80% or even more of children in schools could be kept healthy without needing to make a trip to the dental office, for those who have tremendous barriers doing so. We use what we call a continuous presence system, where we had the hygiene team was there all year long. Now, it doesn't mean 5 days a week. It could be one day every other week, but still being there all year long and coming back on a regular schedule, which raises everyone's awareness about dental care. People start to think about dental care. Teachers start to use dental examples in their math lessons, et cetera, et cetera. And so that increase in awareness about dental care has all kinds of benefits. So the principals start to go to their own dentist more than they were before. Just puts dental care in the air. It's a very, very important way of doing it, where some people who've been doing community care would send a team out, they're there for a week and then they're gone for a year. And that's just not nearly as effective as raising people's attention and awareness to dental care. And then, of course, this idea of using telehealth integrates the dentist in with the community organization and makes really this full service system of care. So we started out doing this in California, really before it was really even thought about in most of the country. And now we've really gotten to the point where across the country, there are states that are beginning to pass laws to allow telehealth to be practiced. California is one of the states with the most advanced policy environment to allow this to be done. But there's some other states, like Colorado has a good policy environment. So does Oregon. Some others are close behind. But it's really starting to sweep the nation. My prediction is, if you ask people if they're using teledentistry as a part of how they do dental care in 20 years from now, the answer is going to be, well, of course we do that. Why would we not do that? It's like, asking us if we use fluoride or do we have handpieces or something. But right now we're not at that place, but it's clearly coming. And the other, I think, major thing, other than this is going to be just a part of everyone's oral health life, is that it's really starting to give us the opportunity to think differently about oral health care, that we can start to think about what I refer to on this slide as a community engaged oral health system. So instead of dental care, the idea that dental care happens in dental offices, now we can start to think about that dental offices are one component of a community engaged oral health care system, where some things happen in the dental office, but other things happen in the school, other things happen in the business, other things happen in the nursing home. It's all one system that can now be linked together using telehealth tools and technologies. So that sort of brings us to the end of that sort of introduction, sort of broad introduction about what's been going on in terms of the advent and the acceptance and understanding about telehealth. And these are sort of like, label these the golden rings of our future as we increase our system that provides incentives for being able to make people healthier and do it so at a lower cost. Increase knowledge about how to reach people using telehealth-connected teams. And then when we're with people, apply the very best cutting edge prevention and behavior science that is going to really make a difference. Now, of course, something happened in March, and we're all on a bit of a detour in terms of that kind of progress. COVID-19 has shaken up every aspect of our society, and dental care being one of them. So there's increasing now attention to, well, okay, how does teledentistry now play a role in the COVID world, or starting to emerge from the COVID world? I would say we're not that far emerged, although we did have an initial dental offices being pretty locked down, and many dental offices are beginning to open up again. But still, we're very much still in the midst of the impact of this pandemic. So there's various groups that are starting to produce guidelines and ideas about what to do. This is from the American Dental Association. They have actually really lots of good publications. I advise you to take a look if you haven't at their pandemic web pages. This one's about using video conferencing, and it's really more about just cybersecurity, how to do it in a way that's secure, but at least there's a recognition that that's an important part of dental care now and will be in the future. And so there's other providers, lots of dentists are thinking, okay, I get the idea that maybe teledentistry might be a good thing to do. And so people are going out and, getting like a free system, signing up for a Zoom account or something like that, or there's a slightly more secure version called DoxyMe, and sort of putting together various pieces of a system to allow them to stay in touch with patients when they're not physically in their presence. What we're going to talk about today is the idea of really a very much integrated all-in-one system. The idea of the real advantages of using a teledentistry system that has all these pieces put together, where you have the ability to have people sign up, post some records, like maybe some photographs or other kinds of things, into a secure portal, fill out forms, sign consent, make their own appointments for a live video, all those things in one place, and where there's an integrated permanent record of everything that happened in one system. So there's some huge advantages doing that over getting something to do video conferences, something else to sign forms, and something else to collect payment. And those things are all doable, but anybody who realizes that we're in this world for a long time is going to gravitate towards a much more all-in-one full service system, as opposed to just putting together a bunch of pieces. Although lots of people are out there advertising, hey, let me tell you what I do. I put together these 12 pieces into a real system. Well, it's not really the kind of system that I think people are going to want to have in the long run. Let's just walk through a little bit of a diagram here, just to see how such a system might work if you're not already doing some version of this. So, you would have a way to notify patients that you have a system available. That could be through perhaps a link on your web page, sending out a blast email or letters to all your patients saying we can actually help to provide your dental care, or at least be in contact with you through this new teledentistry system we have. The patients can call the office, or the office can call the patients, or the patients can just get that notice and go ahead and register and sign up in a patient portal. They can upload photos and select the kind of appointment they want, pay or provide their coverage information, fill out forms, sign consent, schedule an appointment. The office is notified about all that stuff. And then the office, at the time of the appointment that the patient made, have a synchronous real-time video conference where you can provide, the dentist can provide advice. Maybe that for many people, that's all they need. Some people might need a prescription. Some people might just want a follow-up video conference. And then if they do need to come into the office, at least plan for a very efficient in-person visit, which we'll get to in a minute. And then all that stuff's captured into one permanent record of all the interactions that took place. So from the patient's viewpoint, they're notified about a system, they register, they can choose what kind of level of response. They need to talk to someone in the next hour, can wait a couple days. They can pay or put in their Medicaid number, fill out all the forms, upload photos and text, and then schedule the kind of appointment they want. From the provider's viewpoint, they're able to be notified that a patient has signed up, have a secure video conference, again, provide advice, consultation, triage, and then plan for an in-person visit if it's needed. So back to the American Dental Association, again, they have all kinds of good material about billing for distance and video conferencing and other kinds of distance interactions. And so I won't really spend much time on that, other than the fact that these things are being widely covered now. And so, patients can pay obviously direct cash payments for these things, but many commercial and even public carriers like Medicaid programs are beginning to cover these kind of distance education or distance interactions. And so their ADA's coding and billing guidance, they update that pretty frequently, and it has the policies of many different kinds of carriers, including this page has a bunch of different codes that are being billed for. So if you think about all that, the advantages of having one optimized system where everything's together in one place are, for the patient, it's a secure one-stop access to their provider. For the providers, it's a way to maintain contact with patients, the full ability to provide advice and consultation and triage, ability to plan for visits, and then end up with a complete record of all the things that have been done. And then, of course, this keeps people out of the other aspects of the healthcare system, because particularly emergency rooms, if they have dental concerns. All right, so that's just some of the thinking about how these kind of systems are really starting to have people begin to realize we can make a real difference in terms of staying in touch with patients without them all having to, all those interactions taking place in an office. Now, there's of course still lots of concern about what does it mean that offices are opening up. So this is a diagram that was put together by a group that was looking at the risk of various kinds of procedures. The green circles are healthcare workers and the blue ones are non-healthcare workers. So clearly healthcare workers are at higher risk. And they list dentists, hygienists, and assistants at among the highest risks. So there's clearly going to be an ongoing need for lots of care in dental offices and PPE and disinfection in ways that we never really imagined we would have to do before. Another take on that same idea of how risky it is this is from the National Academy of Science proceedings, and they've taken an interesting look at this where they've looked at the importance. They compare sort of risk and importance, a different sort of set of parameters, risk and importance. And it's interesting that they listed dentists or people visiting dental offices among the highest, towards the top of the list of what people should do. I think part of that was the idea that dental care is important. Dental disease doesn't get better by itself, and if people are not getting dental care, that they're likely to get into more problems later on. It's funny, it's almost second only to banks and financing. Now, that's sort of odd to me because I think you can do lots of banking without physically going to places. But maybe the way to take home from this is the recognition of how important dental care is, but also to think about, as we're talking about today, that doesn't all have to be done in person with people. And there's a broad recognition. This is a survey from DentaQuest. 94% of dental providers anticipate long-term changes in dental practice, including things like pre-appointment screenings, asking about traveling and social distancing, wearing additional PPE, enhanced disinfection. So all that stuff's going to be part of our future for a long time to come, making dental care in the office more complicated and expensive. So the American Dental Association has also come out with this return to work toolkit. And there's, again, lots of good things in there, including a patient screening form and other sorts of tools that are really, really valuable. If you haven't seen it, I encourage you to take a look at it. Also, the Center for Disease Control, CDC, is coming out with updated, this was just a few weeks ago, their updated guidance for dental settings. And what I find interesting about both the American Dental Association and the CDC guidelines is the underlying assumption, if you read those documents carefully, underlying assumption is that people are going to be coming into the dental office, period. There's really very little attention to, are there some things we can do to keep people from coming into the office at all, or to even shorten the time they're in the office, all about stuff that you're going to do about people coming into an office. So it's sort of like, even in the CDC guidelines, they refer to this thing from the National Institute for Occupational Health and Safety, NIOSH, called the hierarchy of control. So some of you may have seen this. It's sort of a way of categorizing what kind of things you might do and how effective they could be. And at the top of the pyramid are the things that are considered to be the most effective. And that's, doing things that actually eliminate the risk, or at least substitute something else for a highly risky procedure. At the bottom, the least effective things you can do are PPE and environmental controls and engineering controls. It's interesting to me that in the dental industry, what I see, almost all the attention is at the bottom of the pyramid, the things that are actually least effective that you can do. The DentaQuest partnership came out with a expanded version of this a couple weeks ago, where they do talk about some things under elimination and substitution, but actually none of these things really keep people out of the office or even shorten the time in the office. So we're going to really focus for the next couple of minutes on the top of that pyramid, eliminating and substitution. And I'm going to do it in the context of what I'm going to call here the four-part dental office of the future. And the future really starts now. So let me walk you through this diagram and tell you what I'm thinking about and what we're talking about and sort of emphasizing today. So for dental practices, clearly there's a recognition they're going to have to become better equipped to deal with an infectious environment through airborne infections than ever has been the case in the past. We pay a lot of attention to bloodborne infections, but not so much airborne. So there's probably going to have to be some highly modified operatories, places where you're going to be producing aerosols and doing complex procedures. And those are going to have maybe the highest level of protection, but also the highest level of expense, both expense in maybe remodeling the operatory or setting up some kind of negative airflow system, or at least amount of PPE used in those places, walling off that part of the office so that the air in that office doesn't drift over into other operatories. So it certainly would be advantageous if you can take care of people without using those highly modified operatories. So I think that there's going to be offices that in the future are going to be able to sort of segregate the most highly modified operatories and some that are less highly modified, where you can do non-aerosolizing procedures. And that's where the thing I was talking about a few minutes ago about minimally invasive dentistry and understanding all the things you can do with sealing caries and interim therapeutic restorations and glass ionomers and so many things that we can do to keep so many people healthy without producing aerosols, that it really is important for every dental provider to be very much up with all the advances in minimally invasive dentistry. That's not the topic of today's presentation, but you'll see we're going to offer all of you the opportunity to be in a learning community where we will be able to get into a lot more detail about how to use those minimally invasive procedures. But the other thing I want to point out here is this cloud on top of the office, and it's not a dark cloud. This is a very bright cloud. This is the teledentistry arm of the office. So for a moment, let me just focus on just making office care work better. Let's say everyone's going to come into the office that you're going to see, but still, if you could have pre and post visit care through a teledentistry system where you could talk to the patient ahead of time, maybe some people you'll decide don't need to come in through just some advice, but even if they're going to come in, you could explain to them what's going to happen, provide all the instructions for them about what you're going to do, have them maybe upload some pictures of their mouth so you can be a little more aware of what they're coming in with. Say it's a broken tooth, and show me you have a picture, you're kind of better prepared for what the tooth's going to look like. They can fill out paperwork, sign consent, have a real-time video conference, and all that stuff ahead of time can produce real advantages in shortening the time that they're in the office and making that office time more efficient, even helping to sort out, are they going to be someone who's going to end up one of these highly modified operatories or maybe a minimally modified operatory. So we're starting a project now, and we're going to be working with a virtual dental care company. We'll get more into that in just a few minutes. And the first part of the project has just been an opinion survey. And so we're collecting information from a lot of different dental providers about their prediction. If you had this kind of setup, you've had all these things in place, how could you actually reduce or eliminate office visits? So, the first question is, if you had this full service teledentistry system and you had all the protocols and training of your staff and knew how to use it and were using it the best way, could you eliminate visits? How many visits could actually be eliminated where the person doesn't have to come in at all? I'm talking about things like a problem-focused evaluation. Someone has a problem, you want to talk to them. Not everybody at the end of that conversation ends up coming into the office. Or a post-operative evaluation, just a post-op visit. Many post-op visits people don't need to be, you can do them perfectly well over a real-time video conference. Treatment plan presentation. There's some real advantages, actually. It's better to do a treatment plan presentation these days when you're not in person because you're not wearing PPE and you're having a conversation with a person. The interpersonal dynamics are very important. And if you can do that in a way that you're on a secure and robust video conference and be able to talk to the person, they actually see your face, that's going to be a much better presentation than one where you're in a spacesuit trying to talk to them. Some problems that you evaluate just don't need a visit. And then even things like what I'm referring to as guided oral healthcare instructions, just daily mouth care, minimally invasive procedures, the application of fluoride varnish. In California, it's legal to mail someone one-time packet of the single-use dose of fluoride varnish and then get on a video conference and talk them through how to apply it. And you can charge for that as an office visit or even a fluoride application. Maybe you're mailing them a high-dose fluoride toothpaste or giving a prescription to go to a pharmacy. So all kinds of things that can be done, even recall visits on some healthy patients. I think most dentists realize that there's some patients who do such a good job of their own home care. When they come in for their recall visit, maybe it's not a time they even need new x-rays. They come in for the recall visit. You're really, doing a prophy because that's what you get paid for. You're removing some plaque, which is going to be back in 24 hours. And sometimes even some of those healthy recall visits on healthy patients can be done over a video conference system. So what I'm getting is estimates of anywhere between 20 and 50% fewer in-office visits. The 50% was from a pediatric dentist who says, yeah, he has lots of parents that bring their kid in because they're concerned about something. They They talk, he takes a quick look and he gives them some reassurance and they're gone. He thinks up to 50% of his visits could actually take place over a video conference as opposed to in office. Most of the dentists I'm talking about are not in that category, some 15, some 20, some 25, some 30. But just imagine if you could have 20 to 50% fewer in-office visits, what that might do for the flow of patients, just the traffic in the office. And then even for people who come into the office, think about the idea of how you could shorten the visit in a video conference ahead of time to understand the patient's concerns, set expectations for the visit so they know what's going to happen when they come in, upgrade their demographics so you're still living at the same address, and has your insurance information changed, all that conversation that typically takes place at the front desk where people are breathing on each other, do all that over a video conference system ahead of time, update the health history, explain what's going to be done when they come in so you don't have to do that while they're sitting in the chair, getting consent for any procedures you're going to do, and then really planning for whenever you can minimally invasive procedures. Again, in the first phase of this project we're getting estimates of 20 to 50% shorter people who could have shorter visits. So, those two things taken together, between 20 to 50% fewer in-office visits and 20 to 50% shorter visits, that's really a huge benefit to really to everyone. Less invasive procedures that are going to be done, less use of PPE, less crowded appointment books, lower in-office costs, lessen the infection risk for everyone, and patients are going to be very appreciative. I know I am personally very appreciative in some of my physician appointments. Now I can do them over a video conference system. I don't have to get in the car, drive to the office, find a place to park, get there early because I don't know what the traffic's going to be like. I get on the video conference at the time of the appointment, and when it's over, I'm done, and I'm really appreciative of that ability. So I think you're going to find lots of advantages now as people start to get the idea. And then I mentioned the 4 arms of the practice. Well, I've talked about 3 so far, and those are the 3 we're going to focus on today, but just a little bit of a preview. So as people get this idea of the 3-part office, the highly minimally modified operatories, and then the telehealth connection to patients, that really opens up the possibility of, in the future, as society opens up and the pandemic lessens or goes away, the ability to actually connect to community sites like businesses and schools and preschools and nursing homes. And I mentioned this demonstration we did, we were doing a lot of that. But once you've got the understanding and are able to use a telehealth system, there's all kinds of opportunities to be able to connect and expand your horizons so that your dental care practice is not confined to the 4 walls of the office, but it really is a community engaged practice. To be able to put into place all of these different kind of workflows that I talked about, to be able to use a teledentistry system that's an all-in-one system that has all these components, and then to emphasize the principles of minimally invasive dentistry as you're producing good health for patients and lowering the cost of doing that. And so I think about all this stuff as the golden rings of our future in telehealth-connected delivery systems, people beginning to adopt prevention science, and even thinking about how we get paid for all this stuff. There's a question in the question box. I'm just going to answer that, and then we'll turn it over to Dr. Jackson for a little bit of a demonstration about the full-service teledentistry system that Virtual Dental Care Company has called Teledentistry Communicator. But let me just answer this question first, which is going back to the fluoride mailing to the patient. Is it legal in the state of California? The answer is, and is the bill has the instructions over video conference or not just written instructions. So first of all, it is legal in the state of California. There was actually a law passed. If you email me, I don't have it off on my tip of my tongue, but I can email you the actual code section about the law that talks about the fact that fluoride varnish can now be, in the state of California, can be applied by anyone as long as it's done in a program that's under the supervision of a dentist. So the answer is yes, it's legal in California. And is it billable? It's a little bit ambiguous. So, there was a fluoride application that was done that day. The dentist talked, the little brush with the fluoride was in the patient's hands, not in the dentist's hands or the dental assistant's hands. But still, there was a fluoride application. This is now the next thing I'm about to say is completely personal opinion. I think it's billable as a fluoride application. Other people might not agree. There's some level of risk there. It depends on your risk adversity, whether you want to call for that, document that as a fluoride application and bill for it, but it clearly is legal in the state of California. So I think with that, I'm going to stop sharing my screen. I'll be back at the end to have a few concluding remarks, but I just want to then just talk about the fact that we are really appreciative of the offer that's been made by the Virtual Dental Care Company to be able to use their system, Teledentistry Communicator, as a part of this demonstration project. And we hope that many of you who are on this video conference will join that demonstration And we can have the opportunity, I think, something which will be important for the country, to be able to demonstrate that what the opinion poll I just showed you is actually real when people do it in practice, that we can make a huge difference in practices by having some care done outside the office, and for people who do come in to actually shorten and make those visits much more efficient and safer for everyone. So let me stop sharing my screen now, and Bill, turn it over to you to talk about the actual product itself, the Teledentix communicator.
Okay, well, thank you, Dr. Glassman. Let me share my screen. So the purpose of my part of this presentation is less to give you a demo of our software, which is called Teledentix, than it is to maybe bolster what Dr. Glassman was just talking about. And that is having software that can support all the different things that that he was just talking about. I mean, really, if you want to boil it down, you could probably get Zoom. It's actually pretty expensive if you want to do the HIPAA compliant Zoom, but you could get Zoom, and you could probably build everything else you need around it. It sort of reminds me of when I got out of dental school. Computers were not in dental offices. We survived. And now that I've spent the last several years of my life involved in dental practice management companies, I realize how efficient you can be if you use the right software. And how more productive you can be. And in fact, the opportunity value of using good technology is really good. And this is a little bit about what I'm going to talk about today, that you could in fact start with something very basic, and as the HIPAA regulations or compliance comes back into play, it's going to have to be secure, of course. But you could build something around it, and Paul mentioned it. You could put together, 5 or 6 different software applications. It'll be really cumbersome. It'll be really slow. You'll look really bad to your patients, but that's completely available. But so we've built something now that does take it from A to Z. And I do want to talk a little bit about the background of the company. Again, I'm not going to give a demo today as much as I just want to talk about what brought us to the COVID shutdown, and now as we looked at post-COVID. And what brought us here really was it came from our last company, and by our, I mean our CEO, Richard Lee, who founded Planet DDS. Some of you may be familiar with Denticon as the software that was developed and supported by Planet DDS. And I worked with him there. We first met Paul many years ago when Paul began putting his virtual dental home project together, and he needed a cloud-based application that could support multiple locations, meaning the schools and so forth that his folks were going out to, and multiple providers. Obviously, he was working with hygienists, he was working with dentists and various administrators. So we had that all in the software Denticon, and it looked like a pretty good solution for what Paul was doing. When we sold the company a few years back and began looking for other things that we wanted to do, we recognized that teledentistry really did seem like the future. And so this is going back to 2016, as you can see on the left of this particular slide. And really began focusing on is this in fact the way to deal with the underserved problem that Paul mentioned early in his presentation, because obviously it's a huge one in the country, and it needs to be dealt with, in our opinion, not just from the public health standpoint. I know Paul agrees with this. It doesn't just happen at the non-for-profits level. It needs to be dealt with widely. There has to be reasons for dentists to want to jump into this. So was there a way, this is the question that Richard and I asked each other, was there a way to come up with a method for teledentistry to be used broadly? Is there every dentist out there that would want to get into this? And of course, it has to be profitable for that to happen. It has to be efficient for that to happen. And we did begin working with Healthy Smiles for Kids for Orange County and began looking at how they did. They were using Denticon, so it was our old software, and Paul brought in the teledentistry component to replace the bands that they were using for community outreach, and they successfully implemented a very good teledentistry program, or the virtual dental home model that Paul had pioneered, and it was working quite well until the COVID shutdown hit. So, but anyway, one of the first things we recognized was that as much as we loved our old software, it was not going to fit the bill that I just described. It was not going to hit the goal of being convenient. It wasn't going to hit the goal of being scalable to anybody that wanted to go out into community settings. Nor was any dental software that was devised for in-office dental care. Everything was going to require a workaround. We were never going to get to that goal of efficiency. So we began building a new model, went back to our roots and built a new software model to support Paul's virtual dental home model with the goal of making it efficient. Well, something happened a couple years ago, and you may recognize some of the names that you'll see on the screen, and that is as companies started to create a commercial reason to start using the virtual, well, again, I'll refer to it as the virtual dental home model, but it's the model of sending some type of team or hygienist where it's legal out to locations where they could deliver the care. Typically, it was going to be preventive. Locally, they would gather diagnostic information. The dentist would review it. Again, this is Paul's model. And that, of course, is an asynchronous model. But as we began to develop the model, we also put, with some recognition that it was going to be necessary in the future, this synchronous component, this live video conferencing component. Well, no one used it. And in fact, the dental industry, as you probably all know, just kind of generally shrugged at the notion of a live video conference for a dentist. It just wasn't of very much interest until the shutdown. And then it became of a lot of interest. And then all of a sudden, people that weren't doing teledentistry, we could measure that in weeks. There seemed to be, I think the last time we checked, there were 21 people offering some component of that. So that gets me back to the notion of, okay, so you could use any number of various live capabilities, but they've been out there for weeks. Live video conferencing, I mean, capabilities. They've been out there for weeks. We've been around for 3.5 years, admittedly not using the synchronous component. We were almost entirely asynchronous because that was the model we were supporting with these particular clients. Again, some of them you'll recognize. But nonetheless, we had that capability. When the shutdown hit, we had to scramble to develop it and make it more mature and test it and integrate it into a different workflow than was necessary for those using it at a mobile capacity. But we did that, and we called it Communicator. And that is the product that we're going to help, we're going to work with Paul and help him support the offices that are going to be working in his study. And this is what we consider sort of an A to Z a component of where you don't have to piece other softwares together. You don't have to be embarrassed with your patients when you're using it. You can use multiple things, but it is new. And one of the reasons I so emphasize the mobile component of our past is that we had the synchronous component, we just weren't using it. And so we had to do a lot of scrambling when the shutdown hit, and our customers were saying, we want to use this mobile or the synchronous component. We're not worried too much about the mobile anymore. And we said, okay, well let's work together and we'll come up with it. We didn't truly anticipate that for another 4 or 5 years. We saw it was coming, but we just didn't think it was going to come this quickly. And part of the reason I bring that up is because you're going to see all sorts of new things coming for any user of our software. All sorts of new and great things that are coming that we just hadn't anticipated needing this early. The most important one is integration with existing systems, whether that's practice management system for a bricks and mortar office, whether it's medical systems for FQHCs or medical facilities. That's all on the way. We're in the process of doing that. It takes some time, but we expect we'll be a long way there by the end of the year. Right now, we are integrated with our old software, and we're integrating with others right now, and it's coming fast and furious. But nonetheless, that's one of the questions we first get asked. So I'll just put it out there that that is our goal. We do not intend to replace practice or practice management software or existing software. We intend to integrate with it and use it synergistically. Because there's things that our software can do that really practice management software or medical software will never really be able to do. So let me just go ahead and jump into the components. Again, think of it almost as a stairway. Yes, you could, as we in the old days, I used the pegboard system. Well, you're going to have to at least have video conferencing to begin. But let's sort of walk up the stairway of the other components that we can bring along. Of course, it has to be secure. And again, the guidelines for HIPAA security have been relaxed, but that's just going away. And even if it didn't go away, you would want to be secure even today, even if the HIPAA police aren't busting people. You still do want it, and you want it among all parties. So obviously, if you're going to communicate with the patient afterwards, if the patient's going to communicate with you, if you're going to communicate with people that you're referring to, if you're going to communicate with administrators of a senior home. All of that needs to be done in a secure setting. So all of the communications need to be secure, not just the video conferencing. I'm going to take just a moment to talk about the asynchronous, because everything right now is focused in this industry is focused on the synchronous component, of course. A patient calls up, says he or she has a toothache. The dentist says, let me take a look. Yes, I do need to see you in the office. We'll set something up. We'll call you back. So that is synchronous teledentistry to probably 80% of the industry today. But the asynchronous component, as Paul mentioned, is really important, and not just in the mobile setting that I was talking about. Even in this synchronous setting, I mean, even in this non-mobile environment that we're in today. So potentially, I might want to see in a secure setting, if a patient does send me something upper left corner that, you know, I broke my tooth, I'm going on vacation tomorrow, do I need to see you before I go on vacation? Or something like that, where they can send you the photo. As you open into the patient record, you'll see that right away. You can see that even before you begin a telephone call or a video conference call or a chat or however you're going to communicate with it. We have in this middle component the ability in our software to where you can actually film a short video of yourself. So if you're doing a case presentation, and that was the example I've put in the middle here, of maybe you did a video conference with a patient beforehand about it. In this particular, I'm just giving one of a million different examples. I'm sure you can imagine what it might be. This one might be cosmetic dentistry. So I had a video conference. Maybe the patient sent me a couple of slides or photos, and I'll take a look at those. Maybe I'll have a short video conference and talk and find out more about the patient, introduce myself to the patient. And then later, I can put some thoughts together and do a short video of myself at my convenience. Maybe a 2-minute video that talks about how, yes, veneers are going to be perfect for you. Here's a case that I've done in the past, before and after. Here's a short video that I'm including so that you can see more about what the procedure is like. And I can say more in that video if I want. So this is asynchronous. I do it at my convenience. I record it. I share it with the patient through a secure portal that I'll talk about in a second. And then the patient can look at it. And by the way, I'll put it in with our software, it's in the patient record that the patient viewed it. So I'll know, in fact, whether the patient viewed that or not. So that's another component of asynchronous that is getting rave reviews. I think is going to be a big part of the future of teledentistry, certainly in case presentation, post-op information, and so forth, where you can just periodically ping the patient with more information. And we also have, as part of the patient portal, another important asynchronous component down in the lower right is you can share with the patients educational materials, maybe videos. In this particular example I just threw out, maybe a video of oral hygiene instruction. That's the videos you share are as unlimited as the size of your library of what it is that you want to share with the opponent. So most of what we're going to talk about today is going to focus on the live conferencing, but the asynchronous component is really important also. So one of the first things you're going to want that is obviously not just in a Zoom or a Zoom-like solution is that secure patient portal, because you need to communicate before and after with that patient. A big piece of its forms, as Paul had mentioned before. Some of these, you need approval even to do as I'm sure most of you know, you need the approval even to do the teleconference appointment. We've been told that you can do it verbally. I'm not too sure how safe that is, but we have the ability within our software to put whatever forms you want. They can be customizable. It could be the exact forms that somebody has in his or her practice management system or their medical system. The forms are customizable, fairly easy to use. You can require the patient to fill out the forms even prior to making a video conference, for example, or you can allow the appointment to be scheduled and then require the forms to be filled out afterwards. We have ways of indicating whether the forms have been filled out. You can remind the patient if they haven't. So again, this is kind of all the A to Z type of things that you want in a one place finds it all kind of software. Appointment scheduling is part of the application, and I'm going to emphasize as part of the application. You can do appointment scheduling through obviously practice management software, and then go into a different application, Zoom or something, to do the video conference, but you really kind of want it all in one location. So you want the ability really ultimately to have a book an appointment right away, click that book now, let the patient do it online. Perhaps your staff wants to do it, and they can end up at the same spot. And you want to be able to open from your scheduler into the appointment. So again, if I'm just putting it in some other Calendly or my practice management software, now I have to open into different software to even launch all of the information that I need to do. So if I want to launch the video call, I want to do it all from one location. So you want all this information in one place. And so that when you go into it, now you've got all the information that you need, you just launch. I don't have to go into 2 or 3 or even 4 applications to be able to do all the things that I need to do to communicate with and document my communication with this patient. You want multiple appointment types too. So again, you might be able to do that with your practice management system. I mean, until now, it was really only one appointment type. Again, whether it was Zoom, whether it was FaceTime, it doesn't really matter. I just made the appointment. I told the patient, or my staff told the patient 15 minutes, and that was that. Well, we're a whole lot more sophisticated. We can, in fact, give multiple appointment types and multiple appointment types, durations associated with those types. So that now as we get out, we hit the post-COVID era, we begin to see that dentists are getting a little bit more creative as to the types of video appointments that they want to offer. So I've got a clear aligner consult, for example, in the middle there. In that particular example, I've set it up, and these packages, as we call them, or treatment packages, you can set up in less than 30 seconds, and you can have as many or few, and you can have as many displayed or as few displayed on this particular screen as you want. I can put the duration as I choose, and I can actually put a dollar sign on them if I choose. And if there is a dollar sign, the patient will have to pay an amount prior to, and our software handles all this prior to the appointment going in. So you want to make it as easy as this. Once we're integrated, by the way, and this is the case with the software where we are integrated, this is actually going to reflect the templated times in the software, the practice management software. So I'll use Denticon as an example. If we are integrated with Denticon, this could reflect the templated appointments that the practice has put in for clear aligner consults within the Denticon scheduler. So what you're seeing actually here is the picture. So that is the vision of the future. And again, we're a few months away from that from the majority of software, but we're headed fast time in that direction. So you want to be able to make it easy to both multiple different types of appointments with multiple different types of appointment durations. You want a unique patient record. So once again, I can think of the example of I bring a patient in Zoom, I have Dentrix, I'm in the office, I bring up Dentrix, I bring up the patient record, and that's real good. I can put information into that. But what I can't put into Dentrix is the recording. So I actually go into the recording, I bring it up, maybe I have 2 or 3 or 4 other people involved in the recording, maybe I need a translator, maybe I want to bring in a specialist, or if I'm a specialist, maybe I want to bring in the referring dentist, but I want to record it. And I want that to become part of the patient record. That cannot be imported to existing practice management software. And I could give 5 or 6 other examples that I'm sure you can think of. So, but you do need a unique patient record, again, that just does not come along with a combination of your practice management system or your medical management system and a teleconference software like ours. Referral management is another big component. And of course, as we've been doing for the last almost 4 years, managing mobile, that's exceedingly important. But it's also important if you're doing maybe a triage, or you do want to refer to some other patient. We've got the capabilities right from our software to refer to other providers. And we have the idea of creating a network of providers. So you can, if you are a subscriber to our software, invite as many people as you want. I'm going to say dentists, or I'm going to say other professionals. It can be hygienists, it can be dentists, it can be physicians. You can have a network of as many people that you want to share behind a secure firewall, you can share the records with. And that's extremely important. I'm not going to spend a lot of time on it. Again, the purpose here is not to demo the software, but we have a very sophisticated way of sharing records across multiple providers. They don't have to be subscribers to our software for you to interact with them in a secure setting. Support, obviously very important, and we do have a portal. I won't spend any time on this, but a very sophisticated way of helping people who have our software. So really what we offer, and this is certainly what we bring to the table as we've talked with Paul, we want to be able to study how dentists use this, but we need to give them a complete tool. And we've got a mature software that no one else in the market can even claim, even slightly. It's user tested for 3.5 years. People who are now offering live streaming stuff can't honestly tell you that it's user tested for any more than a couple of months at this point. It's end to end, we feel, and new stuff is coming all the time. We don't ask for compromises on either your behalf or on the patient's behalf, and we can do it all through a single application. It'll be better as soon as we integrate, and again, that's coming. So with that, I will give it back to you, Paul. I'll stop sharing, and if you want to bring up any last topics, please do.
Yeah, thank you, Bill. So it's actually time we can do some Q&A. There's already a couple of questions. I prepared to respond to one of them, but let me just remind folks, we have about 5 minutes left, and we're willing to go a little bit over if people still have some questions at that point. So if you have questions, type them into the chat box. There's one there, which I think, Bill, you just addressed, but maybe we can delve into it a little bit more, was a question about will teledentists be baked into EHRs, or will they still need to use their, it says PMS, I think it means EMS systems for documentation. So I think what I understand, and please help me with this answer, Bill, is you're in the process of trying to get teledentics integrated with as many software products as possible, but that's not how our industry works. We don't have full interoperability between software products, and so depending on the product of a particular dental office, it may or may not be seamlessly integrated. Now that doesn't mean it can't work well together. What I've been telling the people that I've been working with about that is if your product doesn't seamlessly integrate, you can really think about the teledentics system in this, if you're part of this demonstration, as your record source and your operational source for the outside work you're doing with people not in the office. And it's easy to put a link into your progress notes in your office system that says, here's a record of that patient's interaction on this day, and you want to look at it, you click on the link and you're into the teledentics system. So it's not, we don't have a perfectly interoperable industry, but there's certainly ways to make it work fairly seamlessly, even if it's not actually been implemented with a full integration. I don't know if Bill, if you want to add anything to that.
Yeah, I think I'll take it a step further, and I think the question in terms of baked in would mean that if I buy a package off the shelf software, will teledentistry be part of it? So whether it's a Dentrix or an EagleSoft or something, will there be something that's going to be automatically part of that? What I foresee and have been saying for a long time is I think there will be a video conference component, you know, whether they build in a DoxyMe or whatever it is that the practice management softwares are going to build in. I think that will be a component of most software at some point. I think we're probably a good year away. Having come from a couple of dental practice management software companies in my past, I can tell you that you don't just overnight create a new functionality in software. It takes a while to design it. It takes a while to develop it. So I wouldn't expect it tomorrow. And if somebody's going to wait for that, they're going to miss an awful lot of opportunity to use teledentistry. What I will say though, and I'll take it a step further. Everything that I just described will very unlikely be baked into software. So an integration is going to be necessary. There are numerous examples of that out there in the software, the practice management software world right now. For example, when we first started Denticon or Planet DDS a number of years ago, companies like names you might recognize are Demand Force and Solution Reach and any number, and then I can go into other types of other entities that we called, you know, just bolt-on kind of applications. We could have done it all. I mean, we could have built that all into Denticon. We didn't need to work with other companies like Demand Force. The reality is you can't do everything. And so the sophistication of those communication packages, that's just an example. That's what we expect you're going to see in teledentistry too. The sophistication that we bring is going to far exceed anything that most practice management systems will need. So the integration is going to be necessary. So baked in as opposed to bolted on, I guess is what I would say. You're probably going to be better off with a bolted on solution in the long run.
Thanks, Bill. Let me just answer another question about came up about sort of rural practices. I think that was the general thrust of the question. I'm going to put up a quick slide for you to be able to take a look at here. It's a slide that shows just a map of a rural area, and a lot of the predominant structure in the dental industry has been many rural areas are very underserved. Now, I don't want to give anybody the idea that what we're talking about here today is only for rural areas. It's just an example of its application in a rural area, because that was the question. And they're underserved because dentists really can't afford to have a practice there. You just don't have enough of a population to support a practice. So this was actually a slide I made a presentation at the National Rural Health Association recently. Think about a rural area where you have the potential of a dentist locating an office in this small town. There's not enough people in that small town to really sustain the office. But what if that dentist was a sophisticated user of a system like we're going to have in this demonstration project, and say went through the demonstration project with us and learned how to use it and had all the protocols in place? Well, maybe they could either have their hygienist or some other hygienist they're working with have a little office. It could even be, we're not talking about a full dental office. We're talking about maybe renting out on 2 days a week a little place in a medical office or a general health clinic, where they are doing all the stuff that the dental hygienist can do, collecting all the diagnostic records, prevention procedures, having the dentist be able to review those records. And then maybe they can do that in a number of different communities sort of around their rural geographic area. So maybe within 100 miles of that full service dental office, you have these satellite teams of dental hygienists who are collecting records, keeping a lot of people healthy. But then if someone does need to make a trip to the dental office, they certainly can do it on occasion. They might not come there on a regular basis. They might be able to do it on occasion for some kind of advanced procedure. But all of that produces a dental care system, again, a community engaged dental care system that makes a rural practice viable where it might not have been so viable previously. So I hope that addresses some of the ideas, just an idea about rural practice. Also, there was a question about from Carolyn Brown. Hello, Carolyn. I just sent you an email. So nice to see you on this video conference. Asking about how teledentistry could be more widely used by care team and care coordination and health education. Yeah, it's a great question. And we're actually very much involved in that right now through the many virtual dental home projects that I'm working at, who are not really out in the field anymore. They're not going into the schools and preparing in a very sort of what's going to be a very slow and bumpy way to resume school practice. We're working right now on some protocols for them getting in touch with parents and children, being able to interact with them. We think there's a lot of things that can be done over a video conference system, at least to keep people thinking about health, about oral health care, about engaged in preventive practices. We talked earlier about people applying fluoride varnish themselves at home and other things they can do to keep disease they have from getting worse, maybe even some guided instructions on how to clean out that hole in the tooth until you can come into the office and get it fixed, et cetera. So we think there's a huge role right now, and many of the sites we're working very much with in terms of counseling and helping to get them to think through ways of not sort of passively waiting in their office for patients to come back, but actually reaching out to their patient population and being able to interact with them and keep them as healthy as possible under these circumstances using this kind of robust telehealth system.
I'd like to expand on that too, Paul, and talk about medical dental integration and some of the things that we've talked about. In fact, have a proposal out to a Medicare Advantage, on behalf of one of our clients, but a Medicare Advantage provider that includes a dental benefit, a carve-out dental benefit as part of Medicare, where they for patients who have A, diabetes, and B, periodontal disease, they have a no-cost preventive benefit to the, again, part of their Medicare coverage. And so this delivery system, which includes, I think, more than 20 clinics, medical clinics, we're trying to figure out how to offer this benefit in a feasible way. And so again, we had a proposal out, and I think it's worth discussing, because I do think it's one of the ways that we'll see medical dental integration using teledentistry in the future. And that is that a hygienist would actually go into these facilities and with mobile equipment and be able to walk through or set up, if you will, in any of the consultation rooms in these facilities. So they didn't have to have a dental operatory set up in these medical facilities. And the hygienist would then do the screenings for every diabetic patient and determine. We were working with Provisor. There are any number, or we've been talking with Provisor. There's any number of entities that you could use to determine whether or not the periodontal disease had reached a level that's that qualified. But at any rate, they would do the screenings, and they would schedule, if the patient was eligible for the benefit, they would schedule the appointments in that facility. So that now you've got the medical and dental being done in a single location, both the screenings, exams, preventive services, and working with dentists potentially as local as across the street for bricks and mortar if further treatment needed to be necessary. So all of this naturally is going through our software, because that's why we helped make the proposal. But the point being is there were many ways to tie medical into this. And so our record is flexible enough with all of our forms and so forth to be able to talk with and take in information from medical systems. So now we can communicate with physicians on site potentially, or certainly in any asynchronous or synchronous capacity. So I think you're going to see teledentistry being used in care coordination beyond just the how dentists are using it. I think you're going to see it go into the medical world too.
Yeah, thank you, Bill. So I know we're a little bit over time, so we probably should bring it to a close. But the slide that's up there is on the Teledentix website. But you will all be receiving, anybody who's on this webinar will be receiving a follow-up email contact with information about how to either get a demo or join the demonstration. We hope many of you will join the demonstration. We think it's really critical that we actually do something where we can demonstrate for the dental industry the importance of using a system like this to be able to make dental practice more efficient and safer. Again, we see so much of the industry really focused on the least effective things about PPE and airflow, which is all very important, but not nearly as potentially effective as having less people actually walk through the door, and making the visit shorter is hugely impactful for the potential future of the dental care industry. So we hope you'll all join us in that demonstration. We're going to have, as we said, not only are you getting a significant discount on the software, but we'll have a robust learning community where we can share progress and ideas and help each other figure out how to do this in a way that's really effective. And again, I think it's going to make a huge difference for the industry, and we can accelerate the adoption of these kind of things if we were to get together and work on it. So look forward to seeing you in that. You'll get a follow-up email. And thanks everybody for joining us today. It's been a great opportunity to be able to talk with you about these concepts. And I think with that, we'll just say it's either the end of the morning, good afternoon, wherever you are. And we hope to be in touch in the future.